Hey everyone, my name's Konnor. I'm one of the fourth year medical students at UC Irvine in sunny Southern California. I'm applying into emergency medicine residency, but I wouldn't be able to get to that point without passing step one first. And a really high yield component of step one is micro. So let's do a board style question together. You can see the question I have in front of you. So my little strategy and tip is to always read the last sentence of the question first. Sometimes it can throw you off or it can tip you off onto the right answer. Is it a farm question? Is it something you don't even need to read the stem for? So I always read the last sentence first. Which of the following is the most likely causative organism? Okay, so I know they're going to tell me it's micro because I hear the word organism. They're going to tell me something and I have to pick the bug. Now, a lot of people will read the answer choices first. Reasons for reading the answer choices first is to really kind of dig in and hone in your focus. I don't read the answer choices because I feel like it biases me towards certain things, and also the cognitive load of thinking of those 5 answer choices while trying to answer the board style question. I just don't like it. So I read the last sentence first and then the whole stem, and then I read the answer choices. So I have a 25-year-old college student in the clinic with intense itching in his groin area at night, small blue spots and nits attached to his pubic hair, a new sexual relationship, and has some excoriations in the pubic area. What is the most likely organism? So what bug is this? So then I walk through each one of the answer choices, essentially ruling in or ruling out. And if I can't rule out something, I keep it until the end and then gather my evidence for or against. So this first one, I don't even know how to say the first word, but this is scabies. This is not typically where scabies hang out in the pubic area. That's more like the typical test question on scabies is going to be in the webs of your finger. Parasites pubis is another word for pubic lice. So possible, because this is the pubic area. Also the nits as well, entirely possible. Pedunculus humanus capitis, another form of lice. But even if you didn't know that, capitis is the top of your head. So not the right area. Trichophyton rubrum. This is one of your just bread and butter. We cause like jock itch. You get athlete's foot, whatnot. Entirely this area. And then is this gonorrhea? Sure, has a new sexual relationship, but gonorrhea doesn't present this way. So I can rule out gonorrhea. Really don't think it's just jock itch, which is possible, but has these blue spots and the nits. You don't get that in jock itch. This is on your head, so no. And scabies typically doesn't cause this type of, the nits and the blue spots. So I'm going to go with Parasites pubis, which I'm probably mispronouncing. And let's see. And I actually really like doing my tests in tutor mode because I can see the sketch right after. So great. It was B. This is pubic lice. The other thing I should have said, pubis. That tips you off that you're in the right area more than capitis here, which, like I said, scabies typically burrows in the interdigital space, and then everything else is kind of what we talked about. Cool part, I can hit the sketch right here, and I'm going to do it live for you and just load it. And once it loads, I love Symbol Viewer. That is after I've watched the lesson and I'm doing questions, I go to Symbol Viewer, and we're going to focus on this right side of the sketch here. So obviously itching and scratching, this is about scabies too. And so I can click all the way through, but here you go. Pubic lice is also called crabs. And so you can see the little crab shorts over here. And I just click through these to refresh myself. So you can get it like this is lice. So you can get it from the hair in the comb, grips, coarse hair. That's the same thing that happens on the top of your head as well. Sexual contact. He had a new sexual partner. The blue polka dots. This is the blue discoloration of the bites. Again, it itches and scratches, or you itch, you scratch your itch, and you have excoriations. And then you can actually see the nits as well. If you ever hear nits, they're trying to throw you on lice. And so this was a high yield question for step one because they love scabies, lice, and crabs. I don't know why, but they love throwing questions at these. Maybe not as complex as bacteria or viruses, but they love this. Hopefully you enjoyed.